Don't lie my thing, bro. Mama slap you with this man.
Bro, you weird, bro. You talking about shoes and you just bring that whole thing.
Hey, this how you say it. Not for say. Don't let it.
All right. All right, let's look at this bell ringer. All right, so who can tell me their definition of communication? What does communication mean to you?
Collaborate with people.
Collaborating, talking to somebody else, sharing information, talking to somebody you feel comfortable with. All right, what are some ways that people communicate? Texting, y'all like to communicate like that, huh?
Email, texting, social media, emails.
You're too far. I don't know what
If I'm doing next week.
What else?
Emails.
Emails. Oh, y'all talking about it like technology. Huh? Letters. How else can you communicate?
If it ain't working,
Talking, verbally. Yeah. Non-verbally, you can communicate non-verbally as well. Sign language, facial expressions, gestures, eye contact. All right, what form of communication do you think is used most often? Verbal.
All right.
Who do healthcare professionals have to communicate with? Patients, co-workers, other healthcare professionals, patients, family members, their bosses, other facilities that might have to call other facilities for information or give information. How do healthcare professionals use written communication? What kind of things do they have to write? Prescriptions, referrals, discharge stuff. Right. So those are ways that people communicate or healthcare professionals communicate using written. All right. So we have 2 more weeks for this non-week. So we have this week, we have next week. Y'all still need 1 more major grade. Okay. So we are going to be, for the next few days, we're going to be talking about communication. You'll be having a test next week over communication. I have study guides right here up under this clipboard. Print it out. I also have placed it in your folders. I just haven't published it yet. So if you want a paper copy, you can come and grab a paper copy. If you want to do it on Schoology, you can feel free to do it on Schoology, as long as you do it, because it will be a grade. So if y'all want to come, y'all better come grab one now. If y'all want one. I'm gonna pull this basket out because there's too many cellular devices.
You better go back to personal.
I did not just tell y'all that I just sent out what they told us. That's all the emails. They haven't told us anything.
Excuse me. Thank you.
I have no idea. Y'all probably know Friday.
All right, Bo. You just want me to push water?
It's supposed over your nose. I'm out the way and you will come out your way to kick me. You don't have to go back over the proper way to wear a mask.
The proper way to
No, it's not. Then you go over your nose and mouth. You were just sick.
Yeah. Don't mind video. What do I know? But my said that I be nigga.
You can have there are other things besides COVID. I don't want to.
I'm gonna
Huh?
I'm gonna
That is so. That's what's fine.
I already had.
You had Omicron? Trying to tell you, Omicron easy to catch. All right. Oh, when y'all come back, we're gonna have the basket back out. Y'all ain't responding. Look, I got folks just steady just texting and they phone. I tried it, it didn't work. We're gonna go back to how it was. All right. No discussion. That's it. All right, it's over. I tried it and I don't like it, so
Your
that's
parents said you just hate.
I don't hate. They don't want to be making fucking a test. It ain't my fault.
Wow.
After you finish this lesson,
Y'all flunk y'all test, don't do y'all work. We get called in the office because y'all don't do y'all work. I get called in the office because I got ifs. So I don't like that. I don't like this. So that's why. That ain't hating. That's like I don't like to be lame because y'all do y'all work. All right. So objectives are to define communication and its role in the healthcare industry, distinguish between or among verbal, written, and nonverbal, and the understand and use therapeutic communication guidelines. Remember, I'll tell you what you write down.
You don't need it?
Yeah.
They should tell us what we need to write down.
This is not what you have to have in the kids section. It was today, so I don't have to take notes. All right. So the classic definition of communication is the process of exchanging messages. So you have few other professions that require the level and range of communication skills that the healthcare industry does. This atmosphere, accurate communication is vital. Healthcare professionals must communicate effectively and appropriately with other healthcare workers, patients, and clients, and their families, students, visitors, administrators, and business contacts. The greater responsibility for communication rests with the healthcare worker. Communication exists in many forms. You have verbal, written, and nonverbal. So these are all types of communication. And like we talked about, these are who you communicate with as a healthcare professional. You got your other healthcare workers, like your coworkers and stuff, patients and clients, their families. You might have students that come in if you're like a preceptor or something like that, visitors, all those people. Which of the following is the best definition of communication? Process of exchanging messages. With whom must healthcare workers learn to effectively communicate? All of them. So you got your coworkers, patients and clients, students, visitors, administrators, and business contacts.
verbal communication.
All right, so verbal is the use of language and words to send and receive information. It can take place face-to-face or over the telephone. It can also occur one-to-one or in a group. And since we're in the time of this pandemic, also a lot of times can occur like over Zoom or Google Meet and stuff like that. Verbal communication. It's the form people use most often, and it is the most effective because if you're verbally communicating with somebody, that means that you can get instant feedback and discussion. If you have to do written, you have to wait on a response, like an email or something like that. It can end confusion instantly, bring about clarity and understanding. So the goal for verbal communication in the healthcare environment can typically be put into one of the following categories. You establish a rapport or a connection with whoever you're talking to. You obtain information from patients. You confirm understanding. You relay information to other healthcare workers and give instructions to patients. And a lot of times I feel like this is important when you verbally, because, communicate with somebody, you connect with people. Like, when you start talking to them, learning stuff about them or whatever. Especially if you have a patient that you have all the time, you start seeing them all the time, you start to get like some kind of connection or relationship with them. On Monday morning, Soraya greets her first patient, Tim, by asking if he had a nice weekend. Which goal of verbal communication is she using? If she goes in and asks him if he have a nice weekend, what do you think she's doing? Huh? Yes, establish rapport or connection. So she's not just going in saying, I'm here to da 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 da. She's at least saying good morning, you know, how was your weekend or something like that. Getting some type of connection. Why is verbal communication often the most effective way to communicate? It allows for instant feedback, clarity, and understanding. So me and Jakaya are talking, we're conversating, we're having a conversation. But if I was to email her, I have to wait or send her a letter. I have to wait for her response. So with verbal, if you're talking to somebody, it's more instant. And you can kind of, with emails and stuff, and letters, you don't really know the person's tone. You know, you can't really tell their tone over like, written. But with, verbal is better understanding.
Tone of voice.
It's been said many times, it's not what you say, but how you say it. This saying refers to tone of voice. A speaker's feelings are expressed through tone of voice. Healthcare workers' tone is very revealing to a patient. Patients can easily pick up on fear, agitation, calmness, and confidence from healthcare workers' volume, rate, and pitch. Healthcare workers must be aware of how they sound. If they can adjust their tone of voice appropriately to the situation, it can become an effective communication tool. They can use their tone to calm and reassure patients, even if the news is bad. So you have to be careful of your tone of voice as well.
Language choice.
With all the medical terminology that healthcare workers are required to know, they practically speak a different language. They need that language when conversing with colleagues. However, when interacting with patients, they must translate the medical terminology into lay terms. Lay terms are everyday language that patients can understand. For example, instead of saying lumbar, you'll say lower back. Instead of costae, you'll say ribs. Because some people are not going to know what you're talking about unless you say, lower back or ribs. At the same time, healthcare workers must avoid talking down to patients by oversimplifying their language. They should also avoid making noises such as and which are meaningless. Finally, they should be careful to enunciate words and avoid mumbling. The result is healthcare workers that sound professional and knowledgeable. That professionalism builds patients' confidence in healthcare workers. In verbal communication, how is emotion expressed? All right, so you write that down. Mm-hmm. Yes. Mm-hmm. All right, what can a healthcare worker do to ensure that a patient understands medical information? Use appropriate language. You know that one too. So what can a healthcare worker do to ensure that a patient understands medical information? You're going to use appropriate lifetime. All right. All right, so Michelle works as a medical assistant at a general practitioner's office. Mr. James is her current patient. Mr. James' last visit was for extreme pain in his lower back. He is now visiting the office for cold symptoms. So you're gonna watch this little video, and then we're gonna talk about.
Good morning, Mr. James. I'm Michelle, and I'll be talking with you briefly before the doctor comes in to see you.
Hi, Michelle.
So let's see. Oh, it says here that the doctor diagnosed you with acute lumbar myositis.
The doctor didn't tell me I had that.
I bet that changes how you do things in your daily life.
I don't understand. All he said was that I had strained my back.
All right, so how was the patient's reaction when he heard he had lumbar myositis? He was confused by the medical terminology because the doctor just told him he had a strained back. All right, what could Michelle have done differently while communicating with her patient? So what we call that? Use what? Use lay terms. Because apparently, doctor didn't tell him that. So she could have just used lay terms.
Good morning, Mr. James. I'm Michelle, and I'll be talking with you briefly before the doctor comes in to see you.
Hi, Michelle.
So let's see. Okay, I see the last time you were in the office you had some back pain.
Oh, yes, I have a lot of pain.
How's your back feeling now?
My back's much better. I'm much more careful now when I'm working in the yard. Don't want to go through that again. Now, if I could just get rid of this cold.
All right, so in scenario 2, Michelle used terminology the patient understood. So how did the patient's reaction in scenario 2 differ from his reaction in scenario 1?
He understood what she was saying.
He understood what she was saying. Because she didn't go out saying you got lumbar myositis. Okay.
Therapeutic communication.
All right, so patients communicate through both verbal and nonverbal communication. Therapeutic communication is patient-centered communication in which the patient is looked at as a person. Therapeutic communication results in improved patient satisfaction as well as improved health outcomes. As a result, quality patient care depends on excellent therapeutic communication skills. When communicating with patients, it's important to remember your scope of practice. Any questions you ask a patient must fall within the scope of permitted questions and boundaries for your field. So, whatever you went to school for, you got training for, that's what you need to stay within. You don't need to be commenting or, giving information about something you don't know anything about, because it's not within your scope. Although working in healthcare, you learn other things. Like I learned a lot from nurses, from doctors about other stuff. However, professionally, I can't just be giving out, information that doesn't fall within my scope.
Therapeutic communication guidelines.
All right, so some guidelines that you need to follow as a healthcare worker when you communicate with patients. You should develop a rapport or a positive relationship with the patient. So you should act and speak in a calm, competent, and comforting way. You should speak clearly and slowly. Introduce yourself to the patient at the start of the conversation. Ask the patient what he or she wishes to be called and refer to the patient in this way. Use language the patient can understand and avoid medical jargon, codes, and abbreviations. For example, do not ask, what is your chief complaint? Instead, ask, what's wrong? Show leadership, but do not be imposing or give advice. Be honest with the patient. Don't provide false assurance.
Therapeutic communication guidelines.
You should use open-ended questions. An open-ended question requires more than a 1 or 2 word answer. As a result, answers to open-ended questions are descriptive and revealing. Examples of open-ended questions are, what happened? How do you feel? Do not ask why questions. Use closed questions only when specific information is needed. A closed or direct question requires a simple 1 or 2 word answer, often yes or no. Examples of closed questions are you having difficulty breathing? And when did you last eat something? Be sure that the question does not lead the patient to an answer. For example, do not ask, do you have chest pain? Instead, ask, do you have pain anywhere? Ask the patient one question at a time. Do not interrupt the patient. Allow the patient enough time to answer a question before asking the next question. Listen carefully to what the patient says. Acknowledge what the patient says with responses such as, I'm listening, I see, and go on. If necessary, take notes so you do not forget information.
Therapeutic communication guidelines.
Allow the patient to ask questions. Allow the patient to discuss his or her concerns and feelings. Be empathetic by looking at the patient as a person and acknowledging his or her concerns and feelings. Don't focus only on the patient's illness or injury, but also on how the illness or injury affects the patient. Ask the patient for permission before performing a procedure. Tell them what you're going to do. Apologize for any necessary discomfort and pain. Because you never really know how people tolerate pain differently. So you might be getting blood. Some people it doesn't bother them to get stuck with needles. Some people it does. So you just apologize in advance. You know, you don't know if it's gonna hurt them or not, but you know, like it's gonna be a bit sick or it might be a little bit uncomfortable or whatever. Be aware of your nonverbal communication. When should an open-ended question be used? Nope. Right. So obtain descriptive and revealing information. Because you're trying to get them to tell you exactly what's going on. So you want to give them a question that's going to give them to be descriptive, to explain, and all that. Which is an open-ended question? The what? All right. What has been your experience with the care our staff provides? Because if you look at like, do you like being a teacher? That can just be a yes or no or one-word answer. Can I help you feel better in some way? That can be a one-word answer. What is your favorite activity? That can be a one-word answer. So if you look at what has been your experience with the care of our staff provides, they're asking for your experience. So it should be something that's descriptive and giving like, revealing information.
Written communication.
Written communication is a form of verbal communication. Depending on the situation, there are benefits to using written communication. Written communication allows the writer time to research and to organize thoughts. Additionally, once written communication is completed, it can be proofread and edited before it reaches its audience. Written communication must be accurate and clear, and it should be brief with logical organization. It should be free of grammar, spelling, and punctuation errors. Finally, written communication should include vocabulary that is appropriate for the reader. Healthcare workers use written communication for the following items: messages and orders, test results, notes and patient charts, informed consent documents, procedures and policies, patient education materials, surveys, and letters and memos. What you need to know. You know that written communication indicates informed consent. Written communication indicates informed consent.
You said it indicates what?
Informed consent. Informed consent.
Selecting the correct form. Before using written communication. Selecting the correct
All right, so before using written communication, healthcare workers must first ask themselves if the message would be better delivered orally. They should also decide whether or not the message requires a written record. Once it has been determined that written communication is necessary, healthcare workers must decide what format the message should take. The written message could be a letter, email, report, etc. Memos are typically used for internal communication. Internal communication occurs within an organization, such as between a physician and a nurse. Letters are often used for external communication. External communication includes items that are sent outside of the agency, such as to an insurance company or to the community. So that's like a letter that somebody's gonna mail out. Which of the following is a benefit of written communication over oral communication?
It can be researched and edited.
Can be researched and edited, right? When selecting the best form for communication, what should be considered? All of them.
Writing memos.
All right, so memos are a form of written communication. They are used often in the healthcare industry, both in printed form and via electronic mail or email. Memos have some standard parts. So for the to section, that should include the names of the people for whom the memo is intended. From should include the name of the person that's sending it. Date, the date the memo is created. Subject, this part should briefly state the purpose of the memo, and then the body follows these parts and includes the details of the message. Especially with like sending emails. Last year was majority virtual. Yes, please, man. We was majority virtual, and I used to get a lot of emails. But these emails would be it wouldn't be anything in the subject, and it'll just be like, I need to take my test, or something like that. So, I'm just having to send, because it's written, so now I got to send a reply back, and then I got to wait for them to respond. So when y'all are sending emails to people, whether it be teachers, whoever, put something in the subject. So at least I know, like, you could be like last week's test or this 9 week something or something, so I can have something to go by. Because when I open up PowerSchool to look, I'm like, okay, well, he don't miss all the tests. So is he talking about specific tests? He talking about this one test? Or he got zeros for everything? Like, what are you talking about? So, be a little bit more specific so that the person that's receiving the message has a better understanding of what you're talking about. Because when I tell y'all them emails used to be, I just was like, well, I have no clue what they're talking about. So vague, no information. So just make sure y'all are doing that. You didn't email me for anything, so don't tell that lie. I didn't have. No, nobody in here emailed me.
The 5W.
All right, so once a format has been determined for written communication, healthcare workers must write the message using the 5W. So who is the audience? What's the purpose of the message? Why is the message important? When did or will the event occur? Where did or will the event take place? So you got your who, what, when, where, why. Which of the following is one of the 5Ws? All of them.
Nonverbal communication.
So nonverbal communication includes methods used in addition to or as a substitute for language. Nonverbal communication includes the following methods: eye contact and facial expressions, gestures and body language, physical appearance, touch, and then proximity. Which of the following is a method of nonverbal communication? All of them.
Eye contact and facial.
Eye contact and facial expressions. Eye contact is one form of facial expressions. Direct eye contact usually sends a powerful and positive message. Smiles also generally communicate a positive message. However, if you have an artificial smile or fake smile, it can often be detected by others. Other facial expressions communicate as well. So a blank stare can indicate fever. A grimace can express pain. A bland look can suggest depression. Healthcare workers must be conscious of both interpreting facial expressions in others and in mastering their own expression to be sure that they are sending the appropriate message. Healthcare workers should strive for an open, friendly expression that is neither too solemn nor too cheerful.
Gestures and body language.
What can the tapping of a foot imply? Crossing the arms, waving. In addition to facial expressions, people can communicate through body language and gestures. Body language sends powerful messages to others. At times, people can use their bodies instead of words, such as when someone nods or shakes the head. Posture also conveys a message. People who stand up straight exude confidence, while people who slouch appear unsure of themselves. Healthcare workers must be skilled both in reading and in using gestures and body language effectively. They should be sure to lean forward slightly when interacting with patients. This body language shows interest in the patient. Describe the facial expression that a healthcare worker should strive for. Healthcare workers should lean back and away from patients to appear interested in the conversation.
Physical appearance.
All right, in the healthcare industry, many workers wear uniforms. Their uniforms send a message that they belong to the healthcare field. Depending on the patient, this message can have a positive or negative effect. Some patients take comfort from the image of someone in uniform, while others are intimidated or frightened by it. Healthcare workers must be aware of these opposing views and be sensitive to how they interact with patients based on how their appearance is received. In addition to uniforms, physical appearance is also expressed by grooming. Someone who is well groomed communicates a positive message. Someone that is disheveled and not properly groomed can send a negative message. Piercings, facial hair, and overdone makeup can negatively communicate to others. I don't really think when I worked in the hospital, I don't think we had many people with like face piercings. Maybe nose, but it was just like a little one. Only thing that they had us to do, really, we had to make sure that our tattoos were covered. So, some people were like, if they wore the scrub top, and it was short sleeves, they'll just wear like a little sleeve that you can pull up over your arm. I just always wore long sleeve shirts up under my scrub top, so that's the only thing that really was concerned about was I'm sure we covered our tattoos aren't showing.
Touch.
Touching patients is required in many areas of the healthcare field. Touch can communicate many things. Touch can also be misinterpreted, which can be a serious matter. Special licensing that is required for healthcare workers provides them with some protection against some misinterpretations. However, healthcare workers must always be conscientious to touch patients with only kindness and respect. Patients can easily detect an inappropriate or uncaring touch. Communication and touch can also be expressed in how quickly and comfortably a healthcare worker moves with the patient. Beyond clinical touching that is required, healthcare workers may also feel inclined to give patients reassuring touches in the appropriate context. In some cases, a kind, concerned hand on the patient's shoulder can communicate far more than words can. So you have to be careful, like when you have to touch a patient. You don't want to give off the wrong vibes. People have been molested by their healthcare workers before. I don't know if y'all seen the doctor that worked with the women's gymnastics team, like Olympic team, I don't know how many years ago it was, but he was molesting those girls. So, it came out and all that stuff. So you have to be mindful of, how you touch people. You shouldn't touch them inappropriately.
Proximity.
Proximity refers to the physical space between people. The distance between people is one aspect of proximity. Appropriate distance between people varies among cultures. Healthcare workers must often invade patients' personal space in order to perform their duties. sensitivity and professionalism are required when patient proximity is an issue. Proximity can also be communicated through height. In communication between two people, if one is standing and one is sitting, the person who is standing communicates authority over the other person. In the healthcare industry, there are many cases where a healthcare worker will stand over a patient who is seated or lying down. Healthcare workers must be sensitive to how their proximity affects patients. Healthcare workers should sit down as often as possible when communicating with patients. So write that down. Healthcare workers should sit down as often as possible when communicating with patients.
You said healthcare workers.
Should sit down as often as possible when communicating with patients. Finally, proximity can also include odors. Healthcare workers who have close contact with patients should be aware of the type of body soap and deodorant they use. They should limit or forego perfume or cologne and practice good oral hygiene.
What you want to write the last thing, dude?
As long as healthcare workers are wearing appropriate uniforms, they need not pay attention to personal grooming and hygiene. Healthcare workers must always be conscientious to touch patients with kindness and respect.
True.
Which of the following refers to the physical space between people? Proximity. Alright, so which ones go under verbal communication?
Oral communication.
So we got oral communication.
Appropriate vocabulary. So no words.
Make sure the person on
Physical appearance go to what?
Proximity is non-verbal.
communication.
Good.
I got those two wrong.
Right communication is verbal. Physical appearance is non-verbal.
Lesson summary.
Alright.
In this lesson, you learn.
Make sure you're taking or doing your bell ringers. Make sure you are bringing your notes to class and taking notes. Make sure you bring your study guide to class with you. So you'll have your test on Thursday next week. What you want me to do about that? What you want me to do about that? I don't know. You gonna be gone the whole week? You gonna be gone the whole week?
Why would you do this?
Huh?